Welcome to Channel 17, the Town of Colonie Government Channel.
Hello and welcome to Focus on Health. I'm your host, Peggy Mello. Today's guests are Julie Eisele, an epilepsy educator with the Epilepsy Foundation of Northeastern New York, and Bill Bantz, the father of a 3-year-old girl with epilepsy. Welcome to the show.
Thank you.
Julie, do you want to talk about epilepsy? Let's do a definition.
Epilepsy is basically, it's a chronic neurological condition where there's a tendency to have unprovoked recurrent seizures. And a seizure is just basically an excess amount of electrical activity in the brain. So brain cells use electricity to communicate normally. In the case of a seizure, it's just too much electricity all at once.
Okay, and what about incidence in the United States? How common is it?
Right. The general incidence is about 1 in 100. But actually those rates tend to be higher for young kids and for the elderly. In fact, in children, it's the leading neurological condition in children. In adults, it's the 3rd leading neurological condition.
Wow, that's more popular than I thought it was.
Yep.
Okay, now signs and symptoms. What are the symptoms of a seizure? And there are different types of seizures, right?
Exactly. The symptoms really range in severity from very subtle, almost not even noticeable, to much more dramatic. So most people are familiar with the tonic clonic seizure.
Right, when you're moving around.
Exactly.
Shaking on the ground.
Right, exactly. And that's what you typically, if they're going to show something on television, they typically show a tonic clonic. It's where there's a sudden loss of consciousness, period of really hyper rigidity. The person typically falls to the ground and then begins having convulsions involving both the upper and lower body. There may be, their respiratory function is suppressed, so they may have some blueness in their lips or their fingertips. Typically, it only lasts about 3 minutes, and then the person resumes, breathing normally, and they go back to baseline. So that's the tonic-clonic seizure. It's very apparent that someone's having that type of a seizure. But there are also much more subtle ones, like especially in children, it's called the absence seizure. And that's sort of like the daydreaming seizure where the child may be sitting at their desk, their eyes may glaze over, they'll look off into the distance. There may be some twitching of the lip, their eyes may flutter, but it lasts literally a matter of seconds, maybe like 3 seconds, 5 seconds. The person will come out of the seizure and then be able to resume whatever they were doing.
So if they're walking or doing something at the time,
they will
fall
pause.
Down, or they'll just pause?
They'll typically pause. It does involve a loss of consciousness, so they call it the daydreaming seizure. Oftentimes teachers would be the first one to recognize these, and because they're so fast and so fleeting, and they would call the child's name, but the child wouldn't respond because they truly are, for those 3 seconds, unconscious. What happens though typically with the absence is they come in clusters. So having one absence seizure, you can just go back and resume what you were doing, but they can come, 20, 30, 40, you can have, 100 absence seizures.
Do absence seizures also happen in adulthood, or is it typically only childhood?
Yeah. No, they're probably slightly more prevalent in childhood. But the thing with seizures is, when we go out and we do in-services to educate employers and schools on what are the signs and symptoms to look for. And we can talk about different seizure categories. This is a tonic-clonic, they used to call it the grand mal. This is the absence, used to call it the petit mal. This is a partial, this is a focal seizure. But in reality, oftentimes the seizures will morph into each other. So it may start off as a partial seizure and then evolve into a tonic-clonic during those 3 minutes.
Is there something that can bring on a seizure, like a flash of light or something in the environment that can cause that, or maybe something they eat or something like?
Right. If you do have epilepsy, something in the environment is not going to cause epilepsy unless it's something extreme, like a brain injury, or if the temperature in the room goes up to 300 degrees, we would all be having seizures. But if you are an individual with epilepsy, different people have different triggers. And it's only really, I think it's a very small percent that are actually photosensitive. So something like a strobe light or even maybe like a television screen or a video screen could induce a seizure in that person.
So what are the causes of a seizure? You've brought your brain today.
Yeah.
You want to talk about the causes?
Sure. Well, the causes basically, actually they say in about 70% of cases of epilepsy, it's referred to as idiopathic, which basically means that we can't really identify a specific cause. It means we don't know. But in reality, there is some sort of underlying neurological dysfunction. It could be something extremely minor, like a very small piece of scar tissue that can't be imaged, or a neurochemical imbalance in the amount of neurotransmitters. So 70% you can't always point to a cause. For the other 30%, they're known as symptomatic, and that's things like maybe a genetic predisposition.
That's what I was wondering.
Yeah. In a few, in maybe, I don't know, probably 5% or 5 to 10%, it does run in families. Other cases would be any sort of like brain injury due to a brain tumor, a stroke, even Alzheimer's, Parkinson's would put someone at more risk for seizures. Mm-hmm. In young children, or in adults, a brain injury. In young kids, hypoxia, loss of oxygen during the birthing process. Sometimes congenital malformation during brain development in utero. The cells didn't go exactly where they should have gone. And then that malformation will then trigger the seizures. So there's a whole host of causes.
And let's say you know that you have epilepsy. What sort of physician would be able to treat that?
Well, definitely you'd want to see a neurologist, but ideally you'd want to see an epileptologist, which is a neurologist that specializes in epilepsy. And certainly if you're a child, you'd want to see a pediatric neurologist.
And we have 2 epileptologists in the Albany area?
Yes, we actually have at least 3 now.
At least 3.
Mostly at Albany Med. And we also have 2 pediatric neurologists. And given the nationwide shortage, that's a really good thing.
So there's generally a shortage of pediatric neurologists or epileptologists or both?
Both. There's a nationwide shortage of pediatric neurologists, and then those that specialize in epilepsy, that's even more difficult to find. But luckily we have 2 of them right here at Albany. So
that's great.
Yeah.
So let's say you walk up on someone that's having a tonic clonic seizure. They're on the ground, their limbs are flailing. What should one do?
Right.
Other than call 911.
Right. Well, definitely for the tonic-clonic, that is one type of seizure where you definitely do want to take certain first aid precautions. If the person hasn't fallen down, you'd want to lie them down on the ground in a safe area. You don't really want to be moving them that much, because if they're in the process of contracting this way and you pull their arm this way, you could actually break their arm. And you could also injure yourself because they're not in control of what they're doing, and the convulsions are, they're very strong. So you'd want to lay the person down, grab, a sweatshirt, a pillow, anything soft to put under their head.
Under their head.
Right,
Okay.
so they don't. Turn them to the side to make sure that if they have any saliva or if there's any kind of vomiting, that it will fall out naturally.
Okay.
And that they have an open airway. If they have anything tight, like any kind of neckwear or drawstrings, loosen that.
And just make sure there's nothing around them that they could hit.
Exactly. Like with the table, with this, if you can't move the furniture, if you can't move the table, you'd want to try to move them away so that they're not banging up against something hard, which would injure them even more. But one thing that's really important is to time the seizure. And really just stay calm and inform other people, that this person's having a seizure and in a few minutes it's going to end. But time the seizure, because the National Epilepsy Foundation says that anything over 5 minutes is considered a seizure emergency. Most seizures will end within that time normally, but if they don't, then you'd want to call 911, or there are certain emergency medications like Diastat.
You don't have to call 911 immediately when you see someone.
Unless it's a first-time seizure, unless
Okay.
the person's injured during the seizure, unless it happens in water, or the individual's pregnant. If it's somebody that is known to have epilepsy and they're on medication, typically you do have breakthrough seizures, or if you're in the middle of changing medications, you may have seizures. They're not totally predictable. In fact, they're unpredictable. So for that type of person, if you're with someone that knows how to take care of you, if you're in school and the school has received training on what your particular seizure action plan is, it's all written out, and we actually work with the schools and the school nurse to develop this. Because the last thing we want to do, especially for a child in school, is to draw even more attention to them.
Right.
So, if their seizures are, we know what they're like, and they'll end within a few minutes. And typically, you don't want to call the ambulance and have the ambulance show up and have the child leave. They can actually go rest in the nurse's office and maybe sleep it off after the seizure's over, and then go back and resume their day. It's only really if it goes over 5 minutes. And actually now there are some medications that you can administer at home. Diastat is rectal Valium, and the FDA has approved it for non-medical folks to administer. So, yeah.
So what about if someone has an absence seizure? What should you do for them?
Right. With the absence, like I said, there is no large motor movement or anything. Typically, you're going to want to keep the person safe and time the seizure. Because like I said, with absence, they can come in clusters. So if it's just 1 or 2, that's okay. But if you have a cluster where you go over that 5-minute mark, so if you have repeated seizures where you're sort of unconscious for like 5 minutes, one will start and then end, and then another one will start, then it can also become an emergency. And the thing really to do is to educate, for example, in the schools, the teachers, the staff, if you're in a workplace, to educate your employers on what your specific directions are for a seizure emergency. And that's why, call our agency, and we have these great tools and forms, and we can go educate your employers on exactly what you and your physician want you to do in the case of an emergency.
I would imagine it would be tough to retain a job, even though they say, equal opportunity employer. Are there employers that are afraid to employ someone with epilepsy?
Both afraid, and then you can have an individual that's been on the job for 10 years and has an excellent work history, and then they have a breakthrough seizure on the job, and then the next day, they have to get called into human resources and they lose their job. So I actually take all the new calls to the agency, and I'm amazed at how often that happens. And again, it's really just because, unfortunately, there's still a stigma associated with epilepsy. And what we try to do is educate folks that it's just like diabetes or high blood pressure or cancer or an asthma attack.
Live with.
Exactly. It's just another medical condition, and this one just happens to affect the brain. But there are congressmen and doctors and attorneys and bus drivers and people from all walks of life that are living with epilepsy, and they should be, and they're thriving and they're productive members of society.
What about the prognosis for someone with epilepsy? Is it generally, how long will they have to live with it? Is it lifelong?
Right. It's a good question. Everyone's unique, and your prognosis really depends on how easy it is to get your seizures under control. Ideally, you want the seizures under control with the fewest side effects from medications. And in certain syndromes, for example, like absence seizures, I believe it's about 40% of kids will actually grow out of them by the time they're maybe adolescents or adults. And also there's another condition, benign Rolandic seizures, that's also a childhood disorder. But there are many other types where once you have it, you pretty much have it for life. It's a chronic condition and you manage it. If you're seizure-free on meds for 2 years, a neurologist might try to wean you off your medication to see if you have sort of outgrown it. So it's pretty unique. Everyone's different. So.
Okay, Bill, it's your turn now. Do you want to tell Emma's story?
Sure. Well, like you said at the beginning, my daughter Emma is 3 years old now. And we noticed when she was about 3 months old, a little over 3 months old, we noticed her having some strange movements of her body. Not the tonic-clonic type movements that you typically associate with a seizure. She looked like, actually we didn't recognize it at first because it looked like she was just trying to learn to sit up. She actually looked like she was trying to do sit-ups in the gym. But you think at 3 to 4 months of age they're starting to move around and learn to use their muscles, and we just assumed that she's trying to learn to sit up, and it didn't happen all that often, so it wasn't as noticeable. Looking back on it, we think probably she was experiencing seizures sooner than we recognized it, but again, like Julie said earlier, sometimes it's difficult to recognize a seizure type particularly when it first starts, when you haven't seen it before, because it can look like a number of other things. An absence seizure can look like somebody's just daydreaming, just staring off into the corner, thinking about something.
Right.
And my daughter's type of seizure, for example, was called infantile spasms. It only occurs in infants, and it's a condition that the body crunches up, the arms and the legs and the body all crunch together, and it looks like you're trying to do a sit-up. And so, when they're that young and they're just starting to learn to use their muscles and move, wouldn't necessarily recognize that. It got to a point where she was doing these things in clusters that we really started to realize that something wasn't right, and then we would notice her eyes would shift up and off to the left, and so we took her in to have her looked at, and that's when she went through a number of different tests and was diagnosed with epilepsy at the time, with infantile spasms.
So were you scared at that point? Were you very concerned?
Yeah, I was a little concerned because both my wife and I, we don't have any seizure history in either of our families. We really had never been involved in it, other than I had been involved for a period of time in emergency medical care and had dealt with it as an emergency situation, but not on a routine basis. And so it was a little disconcerting, to say the least. But we went and got her seen by good, qualified, competent pediatric neurologist, and they were able to diagnose her, and then we were able to start a treatment plan and attempt to work to get them under control.
So she's been on medicine for
She's
2
been on
years?
medicine. No, she's been on
2.5
medicine for a little over
3
3
years.
years. Yeah, she's 3.5 now, and she's been on medicine since she was about 4 months old. So she's been on for quite some time, and she still is not seizure-free. She's not controlled by any stretch. She still has, on average, 3 to 4 seizures a day, and that sounds like a lot, but we actually see kids who have sometimes 50 to 100 seizures a day, and my daughter's condition is actually one of the ones that's particularly difficult to control. We've not been able to get it controlled with a number of different methodologies. Right now, we've tried about a dozen different anti-epileptic medications, and she has some of the treatment options that are available outside of drug therapy are things like a vagal nerve stimulator.
She has that, right?
She has one of those implanted. It's a small device, kind of like a pacemaker. It's got a small wire that attaches to the vagus nerve, which goes up to the brain, and what it does is it fires very, very small electrical impulses up the vagus nerve, and it attempts to regulate the abnormal electrical activity in the brain that.
So it only fires when it needs to fire.
It actually fires regularly throughout the day, and the doctor will set how often it fires based on her condition, and it's basically it becomes almost for lack of a better term, a trial and error situation where you try one setting and you see if it works, and if it doesn't, you try another setting. It's very similar to trying to get a medication regulated. You try a dosage, and if it doesn't work, you increase the dosage. It's the same type of thing. You adjust this with a computer, and you see if it works. We do have the ability to activate it when she has a seizure. We can actually make it fire off if it's not running at the time, at a little bit stronger pulse than what it normally would, to see if it will help stop or slow down or reduce the severity of her seizures. But again, it's not been for us. It hasn't worked to control her. We know of several families that it does. It works great. So it's an alternative treatment to drug therapy that can work to control her. And right now we're working with a specialist at Children's Hospital in Boston with a special diet called the Ketogenic Diet, which is something that they use in children primarily with very difficult to control epilepsy. And basically,
is it all fats?
It's a very, very high-fat diet. It's almost exclusively fats, a little bit of protein, enough protein so that you don't stunt their growth, so they can continue to grow regularly, and almost no carbohydrates, a very, very minuscule amount of carbohydrates.
I would imagine with a 3-year-old it might be difficult to implement.
It can be, and sometimes it's not. For us, for example, with Emma, because she's never really been able to eat regular foods, what we consider regular foods, and she doesn't feed herself. So she's never had pizza or hot dogs or ice cream or things like that. She really doesn't know any different, so she's always only just eaten what we give her. And so for her, it wasn't a big adjustment to get into this because she's pretty compliant when it comes to that. She eats what you give her, and she's fine with it. For children who are a little older and who've had the experience of pizza and hot dogs and cookies and cakes and things like that, it can be a difficult adjustment trying to get them off of that onto something very bland and very high fat. But if it works, and in about 70 to 75% of the children who go on this diet, it works substantially enough that it's worth it to keep going. It can be a great alternative to the traditional drug therapies or other types of therapies that are available.
So is she doing the ketogenic diet without?
No, she's still on the
doing
medication.
both,
She's only
right?
been on the ketogenic diet for about 6 weeks. We just started her about 6 weeks ago, and it can take upwards of 3 to 6 months to get adjusted to it and see if it's really going to work. Again, there's a fine-tuning period with the diet. They start you off at a particular, what they call a ratio, how much fat to how many grams of protein and carbohydrates. But what it does essentially is it puts your body into a state of ketosis where your body, instead of burning carbohydrate for energy, it burns fat. And when your body burns fat, it produces ketones. And when you burn a lot of fat, you produce excess ketones in your bloodstream. And for some reason, and they don't know why, the medical professionals don't know why at this point in time, but for some reason an excess buildup of ketones in the bloodstream for many people acts like a body's natural anticonvulsant and helps to control seizures. It's very interesting. And it's really not, they call it the ketogenic diet because it's based around food, but it's really not a diet. It's not something you can administer on your own. It's not something you should even attempt on your own. It's got to be monitored by medical professionals. We have a doctor who specializes in it at the hospital. We have a nutritionist who's our consultant. She makes all of Emma's meal plans. She calculates the ratios. We're in contact with her on a regular basis. It really needs to be carefully monitored. They monitor her blood work regularly. They monitor urinalysis regularly because there are potential adverse conditions to having a high-fat diet, such as kidney stones and acidosis and things of that nature that you don't want to get into because they can cause even more problems. So it really needs to be carefully monitored.
So they can't just get a low-carb cookbook and
No.
start following it.
Although, and again, I'm not a doctor, so I'm not recommending anybody try these things, but there are some medical practices in the country that are experimenting with, like phase 1 of the South Beach diet, the Atkins diet, and for people who have seizures that may be a little bit easier to control than, say, my daughter's, for example, they're finding that sometimes a high-protein, higher-fat, low-carb diet can be helpful in those people. There are some people that have found that phase 1 of the South Beach diet works well for helping them control seizures because they've reduced their carbs, and for some reason carbohydrate intake in that particular individual causes an increase in seizures, so if you reduce the carbohydrates, you reduce the seizures.
Interesting. So what needs to be done to find a cure for epilepsy in children like Emma?
It's a good question. It's basically like any other condition or disease out there where it's a continual process of research and development, trying to find new medications, new alternative therapies, new alternative treatments that can help control kids particularly with very difficult to control seizures that are not responsive to the medications that we have today. There are some new things that are coming out. They're not out on the market yet, but they're in research and they're in development. Things like implantable medications where there's for lack of a better term, the medication can basically sense your brain waves and attempt to determine when those brainwave activities change and will fire off a medication dose to your body to preempt and sort of try to stop a seizure before it happens.
So instead of taking medicine where you don't necessarily need it,
It
it's
would-
only given when it's needed.
Exactly. It would know when it would need. It would know when it needed to distribute itself, and would make that distribution in your body at the appropriate time. There's some very new stuff on the horizon, and hopefully that will bring some additional benefit to people with very difficult to control epilepsy.
So what are your concerns for Emma in the future?
I guess some of our concerns are, how will she grow and develop, because until we can get her seizures under control, it's very difficult to tell how she will develop, because the seizures are partially to blame for some of her slowdown in her cognitive development. Her gross motor skills are significantly delayed. She's probably at about a 9-month-old level as far as gross motor skills go. And so, our interest is in getting the seizures under control so we can see what she'll really be able to do when she's not seizing 3 or 4 or 5 times a day.
Right.
Because every time you have a seizure, it throws your brain into chaos, and then usually afterwards you're tired, you need to sleep, and then the amount of medications that she's on, 4 medications right now, and each of those has its own side effects and can cause, laziness and lethargy. And so to try and get those under control with the least amount of medications or the best available treatment, that's really our primary concern at this point, is to see how can we get the seizures under control, and then how will she develop as she grows.
Interesting. Julie, do you want to talk about the foundation?
Sure. We're the Epilepsy Foundation, Northeastern New York. We serve 22 counties in Northeastern New York. We go all the way up to the Canadian border, all the way down to Dutchess County. And basically our mission is to provide education and advocacy for people with epilepsy and their family members. Like I said, we go into the schools and educate the staff and work with the school nurse. We explain the side effects of some of the treatments, the medications, how they might affect learning, development, behaviors in children. We do everything. We go into employers and educate them. We have a counselor. We have Medicaid service coordination. We have traumatic brain injury coordination. What else? We have an extensive information and referral system. And we have a number of key educational programs, one of which coming up is our Pediatric Epilepsy Conference. It's going to be November 2nd at the Italian American Center. And we're fortunate enough to have 3 pediatric neurologists speaking. Blaise Bourgeois, he's the head of Boston Children's Neurology Department. He's our keynote speaker. We also have Dr. Gibbons, Dr. Haller from Albany Med. We have 2 child psychiatrists, a neuropsychologist. So it's going to be a great program. So it's
an all-day event.
It is. It's 8:30 to 3:30, and definitely contact our agency if you're interested.
Not only for people and patients with epilepsy, but also for professionals that are involved in the caregiving of epilepsy, or therapists, school nurses, anybody who's involved in treating or caring for or coordinating services for people with epilepsy. This is a program for them as well.
I think that if you compare epilepsy, there's much more of a stigma, I think, with epilepsy than there is, let's say, if I had, diabetes, I guess.
Right.
I think that the people that you would be surrounded by would be a little bit more concerned than any other disorder.
Right,
and
exactly.
I think maybe that conference might be able to maybe change people's hesitancy or opinions about things.
Exactly. It's all about education. And we actually educate young school kids as well. All the way down to 1st grade, we go in and educate them on what epilepsy is, to dispel any kind of stigma. But we also have another great event coming up. Do we have time?
Yeah.
Okay, we have a fundraiser. It's called Confections and Chocolate, and it's March 1st, and it's our largest fundraiser because we're a not-for-profit. We have to do a lot of that. And it's going to be at the Roost, and the theme is the Roaring 20s, because it's our 20th anniversary of this event.
So do you dip different things in chocolate?
We have all local area bakeries and restaurants donate their most decadent chocolate dessert. Ooh. And so we have that. There's plenty of chocolate, but there's also dinner and dancing, and with the Roaring 20s theme, there's going to be, everyone's encouraged to dress like flapper girls and guys in zoot suits, I guess, and so it's going to be a lot of fun.
I'm sure that Wilford's Roost in February will be fabulous.
Yep, it is.
Looking out onto the snow, probably.
Right, it's March 1st. It's a Saturday night. So.
Okay, and do you want to talk about volunteer opportunities with the Epilepsy Foundation?
Sure, we're always looking for people to get involved with the agency. Anything from as simple as, stuffing envelopes and helping us with mailings or copying, to, we're forming an advocacy group, so going to meet with your legislators. We have a task for anyone that wants to get involved.
Okay, and what about further information? You have a number of literature pamphlets, which we will have on hand at the library.
Great.
Do you want to just mention a few of them real quick?
Yeah, I mean, we have an incredible system of information. We have brochures on every topic relating to epilepsy. There's a lot of special concerns with women that are wanting to get pregnant in epilepsy, issues dealing with driving, children, learning. Yeah, we'll definitely leave those for you here to put on display. And you can call our agency, 456-7501. There's always someone there to answer the phone, and they'll put you in touch with the right person.
Okay, and we should also mention the web address.
Okay, it's epilepsyfoundation.org, and then it's /EFNENY.
Which stands for Epilepsy Foundation
of Northeastern New York.
Okay,
Right.
great. Julie and Bill, thank you for coming.
Thanks for having us.
great.
Thank you for having us.
Yeah.
Thank you for watching. We hope to see you next time on Focus on Health.
Welcome to Channel 17, the Town of Colonie Government Channel.